And thank you for joining us. With us here today, we have Jen Anthony, who is a physician recruiter for Meadville Medical Center. Jen, thank you for joining us.
Good morning. Thank you.
So, tell us about your role here at Meadville Medical Center.
So I've been in recruitment for about 12 years, and what that means is we post our job opportunities on a variety of boards, social media, different sources like that. And what we receive is literally a 4 to 5 page document. We sift through that, check some boxes of basic criteria, and then we engage very thoroughly, not in a bad way, but very thoroughly, conversation style. And we are truly recruiting to make sure that the physician or professional can join our family, join the community family, join the medical staff family. And the motive the whole time is, in the back of our brains, is this someone I want providing care for my grandma, for my son, for my daughter, things like that. And if we can check those boxes and we know that it is a long-term fit, that's how it's a successful recruitment. So a lot of phone calls to the next level of a spouse, of a child, things like that, and make sure that they really feel comfortable and integrated into the community. It would be a disservice to start a phone call, start an engagement process. They come here and they feel very siloed or separated and never really engage or fit into what's here. So the recruitment process is a lot of phone calls, a lot of bragging about the community. There's a lot of cool things here in Meadville. Bragging about medical staff. We have top-notch providers here in the community coming from phenomenal training programs. So they're bringing education, they're bringing experience, and they're all right here. So if I get to share that experience and they join the teams or join the family, it's a lot of conversation and assembling a wonderful powerhouse team is what it is.
Start to finish in that process, how long could it take?
Rapid fire, if they're ready, it could be really quick. We're, as you know, independent and community, so we can do things very quickly in our own house. We make our own rules. So we've turned a physician around in less than a month. They were ready, we were ready. Sometimes a recruitment happens at the beginning of their training and we say, yes, it's a go. Lots of interaction, site visits to make sure they're comfortable here, see the spaces that they're in, engage in the community. Some have taken years. So it depends on the physician's status and when they are ready to join the community. Currently we have some physicians that are signed with intention to join us in 2026 and 2027.
Wow.
We've already started that recruitment process to build that relationship. They're continually invited back into the community for engagements, parties, gatherings, meetings, and they're already a part of the teams, even though they're completing training years out from now.
So it's not just people thinking, oh, a doctor's just coming in because there's a position. There's a lot that goes on to make sure it's the right fit. And again, not just the right fit for the hospital, but for the community as well.
Primarily for the community and the patient base. Our patients do choose Meadville. So the patients could go to any other provider. They could easily go to the Erie area, go elsewhere, but they choose Meadville. So we want to offer them the best candidates possible and continually keeping that in the forefront of my thought process in my screening. Again, are my family members comfortable? And I want the provider to be comfortable as well. I don't want them to come here and have frustration in 2 to 3 years.
Right.
Food-based, activity levels, or peer-based, or office. We always show them their office and kind of suit them, as they would prefer. So all of our physicians coming in have a say in how their office is laid out. Where is it at? Who are they working with? Personality vibes. You don't always like the people you're working with. So we want to make sure that's fleshed out and they mesh well before they get here.
So it has to be fascinating. Obviously you're doing a lot of research on the doctor, but you have people coming to you saying, here's an opportunity, we need you to recruit for this position. I'm sure there's times you've looked at it and go, wow, we're going to offer that? That's awesome.
Correct.
And then there's the community aspect where I'm sure it's important for community members to let you know what's going on, to say, oh, hey, this is opening up, or did you know we have this recreational opportunity, or this is happening.
So I'm like the ultimate matchmaker for community, hospital, physician, every direction I'm going, I'm making matches. So when a physician candidate comes into the community, I literally walk them down the streets of Meadville and we go into the stores and I introduce them to the local businesses. I take them to the rec, I take them to local companies, and I brag about what we have to offer here. Because I do choose to live here. I think it's a phenomenal place to be, live and work, all of those things, and I want to share that with the physicians. And if we bring in this education base that they too can share their families and lives here, it's making it better for the whole community in general. So it'll improve local school systems, local economics, real estate market, things like that. So it's win-win all the way around.
What the folks you bring in, what are they most surprised about? Like specifically, name some of those things that they light up and maybe didn't realize, oh, this is here. Like, I'm sure the Mark or the Academy Theater.
Exactly. So hospital-wise, they are very surprised that we have almost every service line represented and represented well. There's only a couple service lines, but it's pretty typical to not have those in small areas. For the size of our community and hospital, we represent very well. Outside of the hospital, they're very surprised with the little boutiques and the revitalization downtown, so they can literally get everything they need right here. The connectivity is also something they really like. Whenever I walk in somewhere, they know me by name. They know kind of my kids' names or local theater productions, things like that, and they ask engaging questions because they care. So the physician would become a part of something more than just the hospital staff.
That's fantastic. And you know, you mentioned it could be within a month, could be several years. Is there recruitment in terms of filling gaps if you know somebody's coming in a couple years, or how does that process work?
We try to keep an eye on like a medical needs assessment and see where our aging physicians are, succession planning, things like that. Try to be proactive. And we also assess the wait times for a patient to get into a practice. We hear some grumblings in the community, so we take that into consideration and see if we do have capacity to increase that service line. If we don't have space, we can't put more physicians into that space, but we always consider what the wait times are and patient census and feedback.
Well, and I was just going to ask about the feedback. So when you have your clipboard at the office and you have a chance to provide feedback, it sounds like it really goes to heart that you're actually looking at it and going through and saying, okay, I see, and then those conversations are happening internally then.
Correct.
Okay, so here, what we're hearing from patients is this. What do we do to address that?
Correct.
And it sounds like a lot of times it's being addressed.
And the benefit of the small town community hospital is it's very flat, is the easiest way to describe that. Administration's available and accessible. Our physicians feel very comfortable being as vocal as they choose with our administration. They march themselves in, they have a conversation, it's often heard, and revisions are applied or things are executed from there. So
you mentioned a pleasant surprise, the kind of colleagues that they'll be working with and the level of talent there.
Correct.
So obviously that's a resource as well where they're going to be talking to other doctors, other staff members to get another idea of what happens. And obviously that has to be very positive. As you say, really good qualified doctors and staff members are working here. So
we have a young medical staff right now, which recruiting is a lot of fun when they are bringing their families and joining a community because they see their peers in that same sweet spot of age, balancing work and life. So when they are able to do that and have the camaraderie between service lines and share experiences, we see them on the football fields together, soccer fields together, things like that. And we don't see siloed mentality, well, you're a GI provider and I'm a neuro provider, so we can't cross paths. They share a lot. They do block parties together, they coach teams together, they're doing fun things in the community together, sharing some nannies and some resources. So they are together here in the halls and outside of, and they choose to do that.
And you mentioned it's important for the families to fit in and feel integrated into the community, and there's so many volunteer opportunities, so many athletic opportunities. There's so much to offer. Is it hard to, or is it exciting to sort of stress all those things that are available here? Because there are so many resources.
It is so very fun to do that. And when they, I don't want to say buy in, but when they commit and engage as well. We do have some recruits staged to start later this summer, and while prepping them and saying with their onboarding, you'll start on this day, you'll move into these areas. They asked about United Way and where can I make my charitable donations and who should I connect with, things like that. So we're easy to pass that information along and get them connected appropriately.
Are you finding that a lot of doctors today are looking for this type of environment where they can make a difference and feel that they can make a
Correct.
difference and have a big impact where they live and work?
Our patients in the area value connectivity and relationship with their provider. They don't want to reiterate their ailments and issues and illness. So when a provider knows the patient very well, they have successful relationships and medicine is offered very well. So with that being said, it's very easy for the patients to stay in the community, and they really like that the patients care. It's not just a number pushing them out. None of our physicians are mandated to see a certain number of patients per day. They practice at the pace that they feel comfortable practicing at.
It's funny, I've told this story before where, I've been at the store and, my doctors there were having a conversation because we're friends.
Correct.
And
they're in the community.
They're in the community. And other people come up and say, hey, doc, thanks for, blah, blah, blah. And it's like, why are you saying this in the store? But
Correct.
But it's that type
Exactly.
of relationship.
Mm-hmm.
So
and they allow that to happen. They could choose to privatize more so and shop at off hours or really have more of a secluded personality. But a lot of our physicians do choose to engage fully in the community and become friends with and very respectful, just helpful in the community.
How has technology played a role in physician recruitment? Does it make it easier? Does it make it more challenging?
I guess you could say it would make it easier with recruitment, but the nuts and the bolts are still relationship building. It's still a connection of human to human. And that will never, I don't think will go away from the patient to provider aspect, so it's not going to go away on the recruitment side of things either.
How far into the process before you're inviting that physician to come and take a tour of the hospital and of the community?
Right.
Is there some initial conversations first before
A lot
that
of
happens?
initial conversations, making sure it makes good financial sense and time sense. They're working and training prior to coming here, so we want to make sure it's worth their time. A lot of phone calls, text messages, emails, some Zoom calls initially, gather some of the decision makers on those Zoom calls so we can put a face with a name, and then collectively we would do a site visit after that. So probably 3 to 4 weeks into a lot of phone calls and engagement do they come in for a site visit. We like to do 2 days in the community. There's a lot to show in the area, so they typically stay at a local hotel or bed and breakfast, and then they bebop, and I stay with them for 24 to 48 hours all through the community, driving around, pointing things out, where we shop, where we go, to get things done, the local resources of Woodcock Lake and French Creek and all of those little fun things.
So you're the matchmaker.
Mm-hmm.
How did you find your match with Meadville Medical Center?
I had done staffing prior in other capacities, and I actually started in HR here. And it's nice, but it's rather dry. And I'm sorry to say that about my teammates, but they're very policy driven and not as human interaction. Once I saw the opportunity over in the recruitment office, I jumped on it quickly.
And it sounds like there's a lot of opportunities like that. So if you're looking, maybe you're coming out of school
Mm-hmm.
and you are trying to figure out what you want to do with life,
Mm-hmm.
there's a lot of opportunities here.
Mm-hmm.
You could start somewhere and grow
100%,
quickly.
right. It's a family. So however you move around and fit in best, they want you to be successful within the family. Nobody is pigeonholed or steered into a position of, I guess, dread. Everyone seems to be successfully thriving and most often enjoying coming to their workplace.
So there's that outside recruitment, but
Mm-hmm.
again, there's also that opportunity within to grow as well.
And a lot of departments offer training opportunities within their department or movement that would allow some growth or training.
And I'm sure there's assistance in terms of somebody maybe starting in one spot, wanting to grow into another opportunity, and the hospital saying, okay, here's that path, here's how you can do it, and here's how we may be able to help you with
Yes, they definitely help facilitate that.
that. Okay. Now, where are you from?
Here in Crawford County.
Okay. grew up here?
Yes, definitely.
What made you decide to say, this is where I want to spend my life?
The easy and honest answer is when I started in physician recruitment, my son was still young enough that he actually came into the office with me in the morning, and then several managers brought their kids in and they all carpooled together to another school, and then I was on the pickup end of things, and then we all met on the bleachers to watch the kids with their sports activities. So it was truly a family environment right from the start. So we all raised our kids together, we carpooled, and we just did life together. So it was easy enough to balance that work life. So
when you say family,
I mean family.
you mean it.
I do mean family.
Yeah. How many times will you talk to somebody trying to recruit and you say that and they're like, okay, I hear that all the time. When they realize, oh, this is a different place to work. When you do say family, you mean
Correct.
family.
I mean family.
Yeah.
So when we interact throughout that day with the site visit, I don't prep or stage anyone or script. I say, hey, we're coming in. This is a candidate coming from their training facility. And when I walk in, they almost always ask about my son, or ask about my daughter, or ask about a local theater production. And we know each other. They ask about my dog. So it's that relationship building that has been a lot of effort put into it, but it pays off in the long run because you feel valued and a part of something.
That's fantastic. What do you do to relax at the end of the day?
I have a lot of hobbies. Okay. So I'm a welder.
Really?
Right. So I'm doing that. I'm a runner. I run some half marathons. I live in a little farm area, so I'm doing that with the hobby farm. So I have a lot going on.
That's fantastic.
Yeah.
Favorite music you like to listen to?
I'll listen to anything, and I want to go to all of the concerts.
And
this area is perfect for it because every artist goes to Pittsburgh, Buffalo, or Cleveland. So, yeah, I have a pretty big concert calendar.
Is there a movie you like to watch to unwind, or
Nope,
no TV
not
show?
at all. I don't have time for TV.
You're outside.
Yeah.
There you go.
I don't have time for TV.
Well, we appreciate you making time for us today.
Yes.
There's so much that goes into it, and I think if you're watching this, the big takeaway is there's a lot that goes into bringing somebody
Correct.
into the hospital. It's not just, oh, credentials look great, but it's a match for the hospital and the community and the patients.
With longevity in mind the whole time.
Jen, thank you for your time.
Thank you.
Thank you for joining us.